So it is my pleasure today to introduce our speaker, Chris Buse, who studies intersectoral responses to the health impacts of environmental change using social science, epidemiological, and community-engaged research strategies. His goal is to understand environmental health outcomes that manifest as a result of dynamic interactions between social, cultural, economic, and ecological systems, and to respond to some of the world's most pressing sustainability and equity challenges. Chris currently holds a CIHR postdoctoral fellowship at the UBC Center for Environmental Assessment Research with 3 areas of research concentration. The first is piloting integrative impact assessment methods to understand the cumulative impacts of multiple land uses. The second is developing intersectoral policy and to incorporate multiple determinants of health into environmental assessment processes. And the third is public health adaptation to climate change. Chris was the inaugural lead and steering committee chair for the Cumulative Impacts Research Consortium, a research and outreach initiative at the University of Northern British Columbia seeking to understand the cumulative environmental, community, and health impacts associated with resource development. We're very excited to have Chris here today to tell us about this work, and I will ask you to unmute yourself and go ahead.
Thanks so much for the kind introduction, Sarah, and greetings, everyone. I'm calling in from Kelowna, British Columbia today. I'm at UBC Okanagan, and before I begin, I just want to acknowledge the unceded territory of Syilx Nation and pay my respects to their elders, past, present, and future. I'm really hoping that today's presentation can provide a moment of distraction from all of us doom scrolling our Twitter for updates on the latest election news south of the border and updates on the global pandemic. My job today, as Sarah mentioned, is to share a multi-year research program on the cumulative environmental, community, and health impacts of resource development across British Columbia. Today's talk, I think what I'm going to do is I'll probably start off by providing a bit of an overview with what cumulative effects and impacts are, talk a little bit about our governance approach here in Canada and BC specifically, and then share a couple of research processes that, to Sarah's kind introduction, are merging social science and epidemiological and community-engaged research strategies to really kind of understand and unpack this idea of cumulative impact of multiple land uses. So I'll do that all in about 30 or 40 minutes. Safe to say that you'll definitely be getting your daily dose of maps and pictures today. And if I had to kind of boil this talk down to 2 kind of key takeaways, the first one's really simple and probably no surprise to anyone who stumbled into an occupational and environmental health seminar series, but that's that environments and ecosystems are the foundation for all life on this planet. They're therefore integral to our communities and to our health. Second takeaway is that understanding cumulative environment, community, and health interrelationships through impact assessment, while challenging, is not impossible. So let's dive in. I was asked to prepare a couple of poll questions prior to this, and I'm just really interested, given the fact that we've got a relatively diverse audience with us today, just to take a quick temperature. And if we could get the first poll question up for our respondents, just curious, how many folks are familiar with the idea of a cumulative effect and or impact?
It should be showing now, so go ahead and vote or poll or do whatever you're going to do.
Perfect. So they're coming in. This is election night all over again, 78% reporting, lots of people familiar with cumulative impacts. This is great. A couple of people are unsure.
All right, we've hit the critical 80% threshold, so I'm going to end this. Then I share the results so everybody can see them.
Perfect.
I stop sharing them, and then you may hear the window from your screen.
Perfect. Thanks, Sarah. So yeah, according to the results that are popping up for me, we've got about half the audience, a little more than half the audience is familiar with the idea of cumulative effects or impacts. About 2 in 10 are unfamiliar and 30% are unsure. So that's helpful. I think what we're going to do then is we'll dive in, and for those where this research area is relatively new, I just want to talk a little bit about this differentiation between an effect and an impact. And cumulative effects and impacts are often treated synonymously, but you can note a couple of really significant differences between the 2 definitions on this slide. The first one is provided by the BC Ministry of Forest, Lands, Natural Resource Operations. The second is a definition that's adapted from a book titled The Integration Imperative that was published by my colleagues at the University of Northern British Columbia. that's really, trying to be a little bit mindful about, the incorporation of not only the temporal dimension of a cumulative impact, but also spatial dimensions, and certainly incorporation of more than environmental impacts, notably health. My colleague Bram Noble has talked about cumulative effects as this notion of death by 1,000 cuts, or the tyranny of small decisions. And when we really take into consideration the UNVC definition by my colleagues Mike Gillingham and Margot Parks and Chris Johnson and Greg Halseth, the notion of an impact is really meant to intend or communicate that an effect might flow, or an impact might flow from a single effect or a combination of effects. So you can think about it as like effective effects or cascades of overlapping influences. And it's really important that teeny tiny semantic difference, because not only does this mean that some of the really formative decisions that we're making in relation to land use, like zoning and land tenures, if we step back and think critically about those processes, they're really setting us on a particular trajectory before exploration or construction or development or extraction or shipping and transportation, all those things that we associate with resource development. That one formative decision of zoning a land a very particular way sets us in a very particular path, and it sets us up to be prone to the accumulation of these cumulative effects and cumulative impacts. So why is this focus important? Well, I would make the case that increasingly in the Canadian scene, the notion of cumulative impacts has really been forwarded as kind of a key criteria to address, to build social license to operate for proponents in the natural resource extraction and development industry. We also know that based on the last kind of 30 years of research in the Canadian scene, cumulative effects really are a good expression of these persistent challenges demonstrating the complexity of social and ecological systems. And that we certainly, a point that I reiterate in a new report that we just released through our center, we need new tools and processes to adequately account for and remedy them. Now, we're really struggling with the idea of cumulative effects in British Columbia, and we have been kind of for the last 5 years in BC. And one place where cumulative effects tends to show up most often in the Canadian scene is in how we govern resource development. So in BC, we've got this environmental assessment process. It's largely set up to appraise the impacts of a single project. So that image on the left, you can kind of see that we get a proposed project. It might correspond with a particular sector and a corresponding set of impacts and lead us to follow a certain set of assessment protocols. Often what we're left with, though, is that singular project gaze that may not necessarily be mindful of that project's interaction with other past, present, and potentially future projects that are having similar or even different impacts on that same landscape. So the figure on the right is taken from the BC EAO office, and you can see, if you can read it, that last bullet point on the very, very far right, the kind of afterthought in the process is, assess cumulative effects if it's warranted. And so the province really struggled with this for a number of years, and to remedy it, the Ministry of Forest, Lands and Natural Resource Operations decided to create the BC Cumulative Effects Framework. And so the BC framework, you can see the outline of the policy guide on the left, a status, now slightly dated status of regional pilots on the right. And there's a couple of things that I just want to pull out, especially from that slide on the right. The first is really a narrow understanding of effects. Effects are largely treated in this process, the BC Cumulative Effects Framework process, as being related primarily to ecosystem values. So these are notably things like moose and grizzly and caribou health, habitat, species range, other valued ecosystem components like old growth forest, and there's really limited consideration of those kind of more than environmental values. We also note some limitations of the current pilots, just insofar as there's limited spatial and temporal scale in some of these assessment protocols, which is raising some really significant concerns, especially amongst Indigenous rights holders, around how do we identify suitable baselines, recognizing that they may already be detrimentally impacted by cumulative effects or impacts. Now, certainly the province is working towards kind of pan-BC coverage with this suite of regional pilots. I'm going to talk about another process that we've been piloting to engage in a similar type of process using standardized data shortly. But for now, it is worth mentioning that certainly cumulative impacts are also a cornerstone of the new Impact Assessment Act of 2019 at the federal level, which certainly includes a broadened purview for EIA or environmental impact assessment practitioners to really explicitly consider environmental, socioeconomic, and health impacts of a singular project and multiple projects. And so it's this kind of landscape level, this recognition that certain projects have these transboundary flows that go above and beyond the project footprint that really kind of requires us to ask the question, you know, what are we missing in the case of these conventional assessments? And this is, again, what others and myself have referred to as the integration imperative, this need to bridge environmental, social, and health impacts into a whole systems understanding that are integrated spatially, temporally, sectorally, and mindful certainly of those multiple land use values that we've discussed. So again, I could probably hazard a guess based on the fact that we're in an occupational and environmental health seminar series, but I am curious, you know, there was, based on our first poll, pretty good familiarity with the idea of a cumulative impact. And if we could bring up our second poll question, I'm just kind of curious, based on the work that you folks do on the call, what land use values, if any, seem to be most important to your work? So we'll give it a second for the votes to roll in here. Starting to see some signals through the noise, which is interesting. Big focus on health so far, which is great. Larger focus on environmental values as well.
All right, we've hit 80%.
Good. So some really interesting results. Again, probably no surprises for us kind of OEH researchers and practitioners. I'm really excited to hear that at least 31% of people thought that these values were equally important in their work, and hopefully that'll provide some pretty good fodder for discussion. But for those of you who overwhelmingly, 44% of folks answered in terms of health values, you know, it is a really good reminder that we've seen numerous calls to action on the Canadian scene to really bring health to the fore in these impact assessment processes. So there's a couple of references that are supplied here, but really as a result of this kind of increasing requirement that's been really brought forward largely through public and stakeholder engagement for different projects, we partnered with different health authorities, including Northern Health, to prepare a whole suite of resources and evidence reviews to really better position and assist their Office of Health and Resource Development to better support and take action on EA, with the recognition that their health office was increasingly becoming overwhelmed with requests from proponents. So doing the academic thing that we did, we prepared a number of different reviews to help support Northern Health. One of those was a review of different exposure pathways identified in the peer review literature, and really kind of asking the question, where does health show up and how does it show up in this kind of EIA or environmental assessment literature? And really what we found is that, you know, the recognition that much of what gets measured in regulatory approaches and in the peer review literature are largely biophysical, either toxicological or related to occupational risks and exposures driven by workplace conditions, and with some fairly limited recognition of the social determinants of health in those analyses. And it's really, really super important because obviously health impacts of resource development are influenced by multiple contexts and multiple drivers. And these changes influence the multiple determinants of health that are obviously on all of our radars as public health practitioners through both direct and indirect pathways. But what was clear from that last slide is that perhaps the evidence is still emerging on some of those social determinants of health, and it could serve as a really interesting burgeoning area for future research. Now, another resource that we prepared in cooperation with Northern Health and the ECHO network was really in response to this question, you know, how do we integrate across these existing areas of impact assessment to develop so-called integrated impact assessments? You know, we recognize that we've got a whole suite of tools. We've got environmental impact assessment protocols, social impact assessment protocols, health impact assessment protocols, but very rarely are they ever brought together into a singular architecture. And so it was through that kind of question that forced us to really kind of deeply consider new approaches and orientations to the way that we wanted to undertake this work. So I'm going to speak to a past project that paved the way for some more recent provincial scale work. This is work that was funded by the Real Estate Foundation of British Columbia, and it was really aimed at envisioning the next generation of kind of integrated resources to communicate cumulative environmental, community, and health impacts. And it was also meant to be a foundation for really good kind of community engaged dialogue. And we started with Northern British Columbia, mostly because roughly half of all exports from the province come from the north of the province. but it only has about 6% of the population spread out over an area the size of France. These challenges of rurality and remoteness and extractivism were certainly front of mind for us. And it's certainly an area that has all manner of land uses and some really significant environmental pressures as a result of historical logging and certainly oil and gas exploration and mining in the Northeast. The other reason why the North was such a significant place to focus our attention was that back in 2016, the idea of cumulative effects was of really significant importance. The provincial policy framework was just getting off the ground, and there was a sense that this was a really, really important dynamic and evolving conversation. So what did our process look like? Well, we started by having just really big, open public dialogues across our case study site communities to identify different types of values that were relevant and to collaborate and prioritize the kinds of things that were important to track and monitor at regional level. So we were really asking, in classic approaches to assessing impacts of resource development, what are the things that typically get taken notice of and what gets missed? And then we searched out, we went back to the university as researchers, we set out to generate a whole variety of data, populate some of those indicators for those values, and develop integrative data displays that told kind of a retrospective story of 30 years of cumulative impacts across our three key kind of case study regions. And then when we re-engaged communities and had conversations about this suite of resources and did some ground truthing, the feedback that was provided was, well, this is all well and good, but again, the quantitative decision-making isn't necessarily helpful. Where's the local context and the nuance? And could you folks imagine a process by which we could solicit or elicit some of those narratives? And so we developed this third phase to this project called data-driven storytelling, where we use some of the data and information that we collected to generate narratives over time. And I want to share some of the stories first that were precipitated from this project. So it was actually a really powerful process, especially when we come back to that question of kind of what's missing and whose narratives become dominant when thinking about resource development activities across the North. And what we found was that many communities have to deal with unbelievable trauma to the land, and it's manifested in terms of a variety of different health stressors, exemplified here particularly in terms of animal health. This was a story that was shared by a woman about a sour gas leak on an adjacent horse farm, and some of the trauma and horror within and between communities that isn't necessarily being attended to. And what's not displayed in this quote is some follow-up narrative where they were talking about how these types of concerns are reasonably regular, but we don't have proper reporting mechanisms or evaluation and follow-up, and that this trauma is often made invisible through financial compensation by proponents of affected parties. We also learned a lot about cumulative impacts of single projects. This is a photo of the WAC Bennett Dam. It's the largest body of water in BC. It generates about 30% of the province's electricity. And the quote, I think, on this slide does a really fabulous job of demonstrating the lasting legacies that dam project has had for the landscape and certainly for Indigenous communities and settler communities alike. And certainly one of the things that was really significant about the WAC Bennett Dam was the displacement of numerous Indigenous communities during its construction and the resulting flooding of the reservoir. And finally, we also learned a lot about, kind of the multiple project impacts, that idea of cumulative land uses and their impacts on the land, and certainly on community development and health. And so this is a photo of the Peace River Valley. This is a place in northeastern BC that is home to oil and gas activity, to forestry, to wind, past hydro projects. They're all impacting the valley. And then we've got Site C. And we were in Hudson's Hope at a time where Site C construction had just begun. And the quote, I think, does a really good job of exemplifying that one of the things that we heard loud and clear is that, jobs tend to often be what brings people to these landscapes, but it's that aesthetic connection to the landscape and to that place that keeps them there. And it raised some really significant intergenerational concerns, particularly in Northern British Columbia, moving forward. So the other thing that we kind of learned at these sessions is that communities were really hungry for different types of integrated tools and resource suites. And so we compiled kind of a whole variety in series, including, this example poster here that's hanging on the wall of the Bulkley-Nechako Regional District Office, in addition to a variety of other papers and policy briefs. We also got some really good guidance that, our next steps as researchers should really be to take a good hard look at some cutting edge examples of integrated impact assessment frameworks and trial some of those tools in BC. And one of the best examples that we found was the CalEnviroScreen. This is a relativistic, equity, and evidence-informed assessment tool out of California. And it does a really good job of kind of integrating a variety of different land uses. And the nice thing about this tool is that it's At the time that we started to pilot, it's already driving decision-making in California, but other states and local jurisdictions have kind of taken up and run with this methodology to really better understand interactions between environmental changes, community stressors, and human health. And so the CalEnviroScreen's early iterations kind of includes this suite of 20 indicators to characterize several different dimensions of environmental change and their interactions with socioeconomic systems and human health. And the method works by creating a percentile rank for each indicator to develop a standardized and composite score for the 4 domains listed on this slide: the pollution burden, which is represented by your environmental exposures and effects, and then your population characteristics, which is driven by your sensitive populations and your socioeconomic factors. Those two things are then combined to represent the CalEnviroScreen score, which in our thinking is a reasonably good kind of single measure of a cumulative impact for a variable or for a suite of variables at a landscape level. In this case, the CalEnviroScreen is modeled at the level of census tracts in the US. And so you can think about each of those little polygons there as representing a score in relation to every other polygon included in that sample. So that's the relativistic aspect of this. So if people are interested in the nuts and bolts, I have some slides that we can walk through at during the Q&A. But our approach really was to kind of ground truth this with impacted communities and really kind of ask the question, how well do we think a CalEnviroScreen style indicator suite would apply to British Columbia? And so we got some reasonably good feedback. We incorporated a couple of other things between multiple different versions. We originally started our analysis at the level of BC's 29 different regional districts, with the understanding that at least that way we had a kind of a governance body where people were responsible for making decisions on the land. But given some of our close collaborations with health authorities, there was also an ask to reproduce our maps at the level of local health areas, which are the results that I'm going to share here in a second. But some key differences between that first version and the version that we adapted to the BC context were really a measure of different industrial land uses, measures of disturbed land, a so-called kind of anthropogenic footprint, climate change indicators, and wildfire burn areas, and a few additional health outcomes. So this is the population characteristics comparison between version A, the best fit with CalEnviroScreen related data and indicators, relative to version B, which is what we kind of gathered based on some of our community engagement activities. No significant differences when comparing population characteristics, but we can certainly note that a big degree of these population characteristic scores are strongly tied to rurality and remoteness across the province as having higher levels of sensitive populations and greater socioeconomic marginalization. When we look at the expression of the pollution burden, what we actually found was that the incorporation of some of these known industrial pressures on landscapes across British Columbia were really better represented once we started to fold those different types of data into this assessment and really recognize those long histories, particularly in the Northeast and the central interior of oil and gas exploration, forestry, and mining. And when combined, we see this interaction between the pollution burden and those population characteristics. So again, the left is the CalEnviroScreen model, the right is our kind of quote unquote BC EnviroScreen. And there's a couple of things that we can kind of take away just in terms of the kind of cumulative pressures that are represented by this EnviroScreen score. So the first is that we know from our review that the CalEnviroScreen scores tend to be slightly more urban-centric when applied to the BC context. They have some limited ability to characterize active industrial pressures that we know are alive and well in BC. We also know that the inclusion of different types of locations and different types of human activities on the land using BC-specific data and being mindful of that context better reflected kind of those known industrial land use pressures. And so the findings really kind of suggest that in the places where those pressures are greatest, that interactive element between the environmental, the social, and the health, they're really greatest in urban areas, but also in areas with longer histories of more intensive resource extraction, so notably the Northeast and the central interior. So I'm curious, I want to come back really quickly to a poll question before I wrap up, but I'm wondering, you've just seen an example of a tool that's really trying to be mindful in terms of how it merges different types of data and information into a single assessment architecture. And being mindful that we're all kind of working in a health space, but with an eye to the environment and an eye to occupational health. I'm just curious where you folks might see some of the potential as far as guiding decision-making across different sectors. So the question that's posed here is, which sectors do you think could most effectively use EnviroScreen style thinking to enhance decision making. There's a bit of a list here. Feel free to fill in the other box as well, ranging from acute care, public health, the EA process and environmental management, planning, social impact assessment, and community development. I'm not sure, Sarah, if folks have the opportunity to check multiple boxes here, but we'll start to see.
They do not. I did not give them
Okay.
that opportunity. Give a little bit more time on this one because there's a little bit more reading to do. Wait for one. Oh, there we go.
Hit our 80. Good. So reasonably strong leaning towards kind of the EA, environmental management and conservation world, strong links to planning, certainly some links to public health and supporting public health. So that's great. The reason I asked this question is for a couple of different reasons, actually, but certainly we know that the drivers of health and well-being are complex. There's no single sector that's going to be able to respond. This is why we have seen the advent of tools like health and all policies and healthy public policy in our discipline over the last kind of 20 or 30 years. So no one sector can really govern these impacts alone. The whole intention of developing suites of tools and resources like this is to really try to think about reaching as broad an audience as possible and really make the case again that these environments are foundational to the ways that our communities develop, but they're also foundational to our human health and wellness. So a couple of things certainly that we can take away from this style of thinking, and just to offer a couple of reflections on the tool. Methodologically, the tool is relatively parsimonious. It's reasonably easy to use, and through some of our engagement with different communities and different stakeholders, they found that it was really easy to understand. And notwithstanding some statistical analysis to validate the model, so whether that be factor analysis or principal components analysis, the feedback that we received was overwhelmingly positive. One of the greatest strengths of the model, or the greatest strengths of the tool, is also kind of its greatest weakness. This idea that we can encourage data diversity and use a whole variety of different standardization techniques to incorporate diverse sets of data. But if robust data aren't available for every geographic unit in our analysis, the model doesn't perform as well because it's relativistic and comparable by definition. So we really need commensurate data points across each of those geographic units, depending on whatever our level of analysis is in this particular process. But some really cool next steps from this work are really to kind of take the contemporary baseline that we've got that's using a range of data from 2016 through to 2019, and now ask the question, what's actually changed over time? Like, let's build in the temporal dimension of this. Think about incorporating historical health data over the last 10, 20, or 30 years, and see how much that model actually changes so that we get that actual accumulation of impact over time and space. And then certainly using some of that information to be able to take a look at different projects that are on the brew and do some prospective work to model potential future impacts from different projects. The other thing, the reason why I really like this tool is that it enables, implicit to the method, you can weight those four indices differently. And we're developing a data platform right now that enables us to kind of play around with a little widget and take this into communities and say, well, what do you think is most important? Which of these values are most important to you? And we can kind of weight and shift and change the model based on public perception in real time. But certainly, any of the analysis that we conduct, I'm really of the mindset that it ought to be ground truth with impacted communities. So that brings us to kind of our last poll just before I wind up here, but I'm curious again, just to think through, what your takeaway or what some of your thinking is around where you see the greatest strengths or opportunities of the EnviroScreen thinking and methods. We'll just bring up our last poll here before I dive into just one quick concluding remark. About halfway there. We're approaching our critical threshold here.
We're getting there slowly. I usually try not to stop it before 75. So get your votes in. Oh, it's sticking hard at 72, so...
Oh, we just hit 75, just before we closed. That's perfect.
Oh, good.
So yeah, so a couple of really interesting signals here from our poll. You know, integration of diverse values was certainly the first choice, with the ability to weight kind of diverse land use values in relation to one another as the second. This echoes and mirrors really well some of the feedback that we've received from conversations with potential data users moving forth who kind of agree with that, that being the strengths orientation of this particular tool. I just want to end again, you know, that first point that I said, if there was one takeaway that you can take away from this presentation, it's certainly that environments and ecosystems are foundational to the way that we develop as humans, as animals, you know, all living beings on this particular planet. In the spirit of some shameless self-promotion, there are a couple of really good resources that I thought were worth sharing with students that have done some kind of deep dives into the field of environmental health to help kind of clarify what are our tools and our approaches and some of these really interesting field developments that have popped up over the course of the last 150 years of our discipline. So I offer those in parting and want to say thanks again so much for the organizers for having me today. And certainly stay safe, healthy, and connected to nature in the midst of this global pandemic.